If you want to know what treatment options your loved one should have available for them in ICU after a heart attack, stay tuned. I have news for you. My name is Patrick Hutzel from IntensiveCareHotline.com with another quick tip for families in intensive care. So today I want to talk about treatment options for your critically ill loved one in intensive care after a heart attack. Yesterday I made a video about diagnostics when your loved one is in intensive care with a heart attack, and today I want to continue with treatment options that your loved one needs to have or can have when they are in ICU. So obviously, continuous monitoring of vital signs, including heart rate, blood pressure, oxygen levels, possibly cardiac rhythm, ECG, to assess the heart's function and response to treatment, medications, thrombolytics or clot dissolving drugs, clot busting drugs. If the heart attack is due to a blood clot in a coronary artery, these medications may be administered to dissolve the clot and restore blood flow, which also includes antiplatelet drugs to prevent further clotting, pain relief to manage chest pain, beta blockers such as metoprolol, ACE inhibitors or other medications to reduce the workload on the heart and prevent complications. Obviously, oxygen therapy, supplemental oxygen, is often given to ensure the heart has adequate supply of oxygen, but also often mechanical ventilation is needed depending on how severe the heart attack was. Many patients with a mild heart attack don't even end up in intensive care, but the one with major heart attacks might end up in intensive care. That triggered my video yesterday about diagnostics, because one of the clients that we're currently working with ended up in ICU intubated after a heart attack because the heart was so weak that the client could no longer breathe and had respiratory failure and ended up in ICU on mechanical ventilation-induced coma and inotropes. And I'll talk about inotropes in a minute. Then other treatment, angioplasty and stenting, if available and indicated, a cardiac catheter may be performed to open blocked arteries and restore blood flow to the heart muscle. Coronary artery bypass grafting, also known as CABG, in some cases bypass surgery may be necessary to reroute blood around the blocked arteries. And of course, supportive care such as including maintaining fluid balance, electrolyte levels, and providing nutrition as needed. Now, other treatment options that can come in is inotropes or vasopressor, depending on the ejection fraction of the heart. I talked about that yesterday in my video about the ejection fraction of the heart might go down after a cardiac event. Ejection fraction is referring to cardiac contractility, the pump function of the heart, and that often goes down after a heart attack because the heart muscle is weak or the heart muscles are weak. And then inotropes or vasopressors might kick in, such as levophed, norepinephrine, noradrenaline, epinephrine, adrenaline, dobutamine, milrinone, also levosimendan. Other treatment options could be an intra-aortic balloon pump, right? And other treatment options if inotropes, vasopressors fail, if the intra-aortic balloon pump fails, if even cardiac surgery fails, other options could be going as far as ECMO. ECMO is a bypass machine that can take over the function of the heart for a period of time while the heart recovers. That would be the highest level of life support. That could be followed on by LVAD or RVAD, which could lead to a heart transplant. So I hope that gives you an idea what treatment options are available in intensive care for someone with a severe heart attack. Like I said, patients with a mild heart attack often don't end up in intensive care. So these, I'm referring here to the most severe cases of heart attacks in ICU, often that might go hand in hand with other organs failing as well. I have worked in critical care for nearly 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and where and I've been consulting and advocating for families in intensive care since 2013 here at IntensiveCareHotline.com. And we have saved many lives as part of our consulting and advocacy. And you can verify that on our testimonial section at IntensiveCareHotline.com, or you can go to IntensiveCareHotline.com and look up our podcast section, where we have done some client interviews verifying that we have saved some lives. That's also why we have created a membership for families of critically ill patients in intensive care. And you can become a member if you go to IntensiveCareHotline.com. If you click on the membership link, or you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email. And we answer all questions intensive care related. In the membership, you also have access to 21 ebooks and 21 videos that I have personally written and recorded, and you have exclusive access to that. It's only in the membership. And once again, everything that we do in the membership, whether it's answering your questions, whether you look at the ebooks and the videos, will help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment. I also do one-on-one consulting and advocacy for families in intensive care over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. I also talk to doctors and nurses directly, and I ask all the questions. And I ask all the questions to the doctors and nurses specifically that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I handhold you and your family through the process, making sure you manage intensive care teams so they don't manage you. Again, all with the goal of making sure you make informed decisions, you have peace of mind, control, power, and influence, making sure your loved one gets best care and outstanding treatment. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. Share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you get notification for the YouTube live if you subscribe to my YouTube channel, or if you're a subscriber to our email newsletter at intensivecarehotline.com. And also, if you want your video done quickly, make a small donation with the super chat button on YouTube, and I will get to your video next, because I have so many emails sitting in my inbox from going back as far as October last year. That's how many questions we're getting, and I just can't get to all of them quick enough. You know, if you make a little donation, the more content we can publish, the faster we can publish, because it also takes resources publishing videos. So that would be much appreciated. I can help you very quickly. It's a win-win situation. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.